Welcome to Adapting Place, and thank you for deciding to join us. We continue with our series with Musculoskeletal. So we're going to do a case study, but we're going to walk through the case study to see how, when they give you a question, this is how you should be thinking about how to go through case study. So you got to participate, ask questions, and I call it on-the-go learning as we go. And we come up with the diagnosis. You have a 45-year-old woman. So it's a female client. I'll summarize it for you. They present to the family clinic with these are the complaint, like joint pain. You have joint pain and morning stiffness. That's your buzzword. 45 female present with the joint pain and morning stiffness. She also complained about fatigue, right? And then notice that the hand and the wrist are swollen. Then they tell you that the pain and stiffness improves as the day progresses. You should be thinking about certain things right now. What are your differential? You should start thinking about your differential. 45, joint pain, morning stiffness, fatigue, swollen wrist. That improve pain and stiffness improve with what? As the day progressed, right? This is affecting morning activity. But as the day progresses, it gets better because the stiffness goes away. She says she takes ibuprofen, but no help. What do you think is going on, guys? I will give you more information. A past medical history, she's obese, so obesity, right? A BMI probably is like 33, and she has hypertension. She has never had no surgeries before, no surgeries, right? So what do you think are the possible condition this patient is suffering from? Can you tell me what you think? And I can give you more information. Do you need more information or this is enough to make a diagnosis? General appearance, she's alert and oriented times 4. The lungs are clear, right? And the heart, so you have S1, S2. There's no mama or anything like that. But when you check the wrist or the hands, you do the extremities, what do you see? You see like symmetrical swelling and tenderness at the wrist. So I'm making things up in the hands and the fingers. This is what you see. And there is a decreased range of motion. What do you think is wrong with this patient? Knee joint, the hip joint, or the shoulder, you're normal. Does this give you a clue? This is how you do case study. Small information. You put it together and you should be able to figure out. 45, joint pain, morning stiffness, fatigue, and wrist that is swollen. This stiffness and edema, it gets better as you move around. She's obese, she has no surgery, hypertension. Physical exams, the only thing prominent is the hands and the fingers and the wrist are swollen and tender, and the range of motion is decreased, but the joint and the knees are fine. What does that tell you? What kind of lab work will you check to help you figure out what this patient have? What kind of lab work will you get? I can tell you we need a surge rate, so ESR, right? So these are the things you will see on your test. Elevated erythrocytes sedimentation is high. Does it tell you anything? What else do you want? What kind of lab work do you want? We get a CBC, is normal. YCAN is normal, right? And then we get a rheumatoid factor. It's elevated. What do you think this patient has? What are your possible differential? Okay. If I tell you this patient has osteoarthritis or she has a rheumatoid arthritis or she has systemic lupus, these are your differential diagnosis, right? Which one will you pick? These are your differential diagnosis. So which one will you pick? Systemic lupus. What would I have to give you to tell me that, A, this is a systemic lupus? Look for butterfly rash. That means rash on both cheeks, right? And then it crosses over the bridge of the nose. That's why it's called butterfly. So if this is the individual face, okay, this is the individual face like that. And then the eyes are here and the nose is here. So this is your cheek. This is your cheek. You're going to see a rash here, here, but you need to cross over to become systemic lupus rash. So this is what you're supposed to, this is what we call butterfly rash. So, and this is not osteoarthritis because of what? Who know why it's not osteoarthritis? This is symmetrical. That's the key. And involve small joints. So osteoarthritis, if this is where to be osteoarthritis, you're going to have so let me put here, if this is OA, it's going to have large joint involvement. You're going to have what? Asymmetrical, just one side. And then you're going to have what? Negative rheumatoid factor. So these are the things you look when you're doing the question. So negative rheumatoid factor. So this is what we call differential diagnosis. So this is what you see in that situation. So in that situation, large joint, involvement, asymmetrical, negative rheumatoid factor. So based on that, we have a case of rheumatoid arthritis. And that's all. That's how you go through the case. You do your differential back and forth. You see what they've given you. You don't get trapped. You go with the buzzword. Your answer choice, you start from the first two sentences and said, okay, I know what it is. And he's trying to improve on it and make sure everything make the criteria. So why is rheumatoid arthritis? It's because it involve symmetrical joints, right? They have morning stiffness. Morning stiffness, okay. Fatigue is also associated with that. Positive rheumatoid factor, right? And then other symptoms associated with it. And the joint, okay, joint improvement, right? Joint pain relieved. Usually, as you move it, it's much, much better. So these are little things you have to know when you you're looking at a case. The joint is really as you move it, it get better. That's why morning stiffness is because the leg has been not been moving, the hands has not been moving for a long time, and so they have problem. So improvement as you move it, it get better. So improvement with activity, that is the key. This is consistent with the rheumatoid disease. Think about it. When you move, more pain. So more pain. So pain worsen. This is a key distinguishing factor. Rheumatoid arthritis, as you moved, your pain get better. Osteoarthritis, as you moved, it hurts. That's why old folks they say, my knee hurt as I moved. Rheumatoid, when you stay still, your pain get worse and worse and worse. I'm just giving you musculoskeletal that you can use for your ankles. These are little, they are not too difficult. People, a lot of people have problem with musculoskeletal. It's like it's just application of understanding and picture the problem. People who knee hurt, they don't want to move it. People whose hands are they have stiff hands and they have deformity of their hands, they want to move it so that it doesn't. That's the difference between osteoarthritis and rheumatoid. If we have to give this patient medication, what do you think recommendation? What do you think we should recommend? You, the nurse, based on the pathophysiology of the disease. Always don't think out of the box. It's based on pathophysiology. And which is what? It's an inflammatory disease. So it's an autoimmune disease. What do we use for autoimmune disease? You know it, right? What do we use for autoimmune? That's your treatment right there. So medication you're going to pick, it has to be affect your immune system. So immunosuppression. You don't have to think too much. So we need to give them immunosuppression. One your NCLEX is going to give you is what? Methotrexate. Don't forget it. Methotrexate. Probably number one, number two is what? What is number two? Number one, you have to know is methotrexate, right? Number two, probably like steroids. And number three, probably um probably hydroxychloroquine. These are three immunosuppression you should know for your NCLEX when it comes to autoimmune disease. These are the common one, right? Methotrexate, steroid, hydroxychloroquine. And you have to know the side effect of each of them. Okay, you have to know the side effect of each of them. So, methotrexate, what are you going to teach him? So, if you have to teach the patient is on methotrexate. That's the MTS. That's our simple way. MTS. That's the same thing. What kind of teaching do you provide for this patient? Start. Number one is a teratogen, right? You should avoid it in pregnancy, right? So they need some form of barrier method, right? They need some barrier method to prevent becoming pregnant. It's very, very important. This is due to the medication is teratogenic. Make sure you don't pick oral contraception. This is wrong because it's not effective. You want a barrier method. Okay, you want a most effective contraception is a barrier method. So that's what you make sure the patient is on. And then infection risks, right? Infection risks. You teach them to ensure neutropenic precaution, right? As much as possible. All these things is application, right? Neutropenic precaution is going to suppress your immune system. So as you know, it's so it can lead to pancytopenia due to suppressing the immune system or marrow suppression, right? So it can lead to pancytopenia, which is due to what? Low RBC, low platelet, low WBC. So there's a risk of infection, there's a risk of bleeding, and there's fatigue, right? You can get tired, you teach them, they get tired, they can have bleeding, bruising, all these things. You got to teach them as much as possible. There is some specific side effects for this medication, you need to know. This is specific that you had. Don't forget it. It's a very bad liver toxic or hepatotoxic, right? So it affects the liver really, really bad. It can damage your liver. If it can damage your liver, what kind of teaching would you tell this patient? Don't drink. No alcohol. Because if you drink, well, the thing is going to destroy your liver. So no alcohol as much as possible. You can't combine, it's going to completely mess you up. The way methotrexate work is it block folic acid. If you never heard about it before, folic acid. So you need to tell them to have folic acid supplementation. So that you give them some vitamins, right? You give them vitamins. So give them vitamin to help with the folic acid. Because if they lack folic acid, they're going to have like mouth sores. This is how they do. So lack of this will lead to mouth sores. So you teach them a block folic acid, give them vitamin that have folic acids in it, and then to prevent the mouth sores they're going to have. These are little things that I know you know, but I'm putting in the case form. And the last thing is heavy immunosuppression, okay? Heavy immunosuppression does not take effect right away. So you need time. There's a delay onset of action, I call it. So it doesn't work right away. It takes some time for it to work. So you got to teach the patient, hey, your symptoms will get better, but slowly, 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 we'll get there. You can't just say, oh, nothing is happening right away, right? So you got to tell them. So that's something you know. There's one thing your board also would like to trap you regarding one of these medication, hydroxychloroquine. Who know, who know one side effect you should know about this medication for your boards? Tell the patient to know, otherwise they become a problem. So what is the teaching specific to hydroxychloroquine? Your board will confuse you with that. It does not cause liver damage. So it's not liver damage, but it causes something. They will mix it with it if you confuse you with that. You should go and see ophthalmology. So they go and see the eye doctor, right? Because it causes what? Retinal damage. So that is something they have to go do to go see the ophthalmology because of retinal damage. So remember, hydroxychloroquine causes retinal damage, and then methotrexate causes liver damage. So they got to do and go and see the doctor eye check. Apart from that, it has some GI side effect. It's not important. It also can cause all these problems, except it does not affect your liver. But that's one thing you have to know. And when it comes to steroids, you all know, right? Steroids, I don't have to say anything. They're going to have cushingoid symptoms. I call them cushingoid symptoms. And you know it, right? Cushingoid symptoms. What? Weight gain, right? Acne, right? You get abdominal stria. So all those things, I don't have to say it. You get cataract. Um, you get diabetes, right? You get depression, or you can just memorize it, right? Or does you get hypertension, fluid overloaded. You see how you can just if you know the content, it just flow. It makes sense to you, right? All those things is going to happen to them. As much as possible. So that are cushion things that you need to know. Risks of infection, it's all part of it, right? And then you can get, they get a obese abdomen. They look like basically asceticism and buffalo amp, all of them, or we call it central obesity. So these are things that you should be able to like rattle it easily when it comes to this problem. So common side effect of the medication you're going to see in the NCLEX and then how to manage them. So the patient came back maybe 4 weeks later and he said, well, um, my symptoms is improving, but it's not completely gone. What are you going to tell her? What are you going to tell her? It will improve slowly. It's going to take some time. Time to get better completely. You may have flare-ups, okay? So this is like flare-ups on and off before you go into remission. And you can come back later most of the time, but this is not going to go away. It can be a progressive disease. You're going to have deformed joint. There's no way you can stop it. It's going to happen, and then you start developing changes in your hands. Right, there will be deformity, deviation, swan neck changes that you're going to do. You end up having systemic um, involvement. That means other organs will be involved. And it's important to be able to follow the strategy that is needed. So these are things you should be able to tell the patient that, hey, all these things is going to happen and they should pay attention to that. So before we finish, lifestyle modification, because that's what the NCLEX will ask you. What do you think? What kind of teaching that you should provide for this patient who has rheumatoid arthritis to prevent the progression of the disease? What number one, what are the things you can teach them? I would say regular exercise. They need to have regular exercise. Usually low impact exercise, not like really heavy, low impact, like what? What are low impact exercise? What do you guys think? Low impact exercise for this patient. One is walking. So let them walk. Okay. Second one is maybe swimming. Let them swim. Swimming are low impact. And Uno, another one that is a low impact study for this patient to improve the activity, low impact. Cycling. Cycling is very good. Involve in the joint and then do range of motion exercise. These are the things you teach this patient. And strengthening. So range of motion exercise and strengthening to help with that. They can also protect the joint. They can use like braces, right? Brace and splint. So braces or splints, they can splint it so that it doesn't get bad. And then they have to make, and yoga. Somebody said yoga. I like it. So yoga is a low impact. And then nutrition is also good. Balanced diet that was a lot of anti-inflammatory, like fruits and vegetables, anti-inflammatory food, which are like fruits and vegetables are very, very good. Okay, fruits and veggie. So the patient wanted to know how to sleep. So sleeping teaching. What do you tell them? If you're sleeping, what do you do? What recommendation will you provide for this patient about sleeping? So what do you want this patient to do when they come to sleeping? What is your teaching? There's option. Let me give you option. In the bed, I want you to have soft mattress. Okay. I want you to have soft mattress versus hard mattress. And then sleep flat on the bed. or head elevated? Which one is a good one? So soft mattress versus hard mattress, and then a flat on the bed or head elevated. What do you tell them about sleeping in the bed? Because it's very important. You got to teach them something so that they can go and buy it and use it. This is a key aspect of their condition. You is supposed to be flat, but should it be soft or hard mattress? They need a hard mattress, really, really hard. So this is your best combination. So flat and hard mattress as much as possible. And this is going to help prevent the stiffness that they're having during the morning. It's a key concept you need to know. Soft mattress is not going to be good and elevating the head. It should be flat on the bed, and then they have the mattress is very hard. So the patient came back, none of the methotrexate not working. And we decided to give the patient Adalimumab, right? What would you do? Priority action for this before starting the medication. Get a TB test. What is that? Place a PPD. And then when you place the PPD, you wait for 72 hours, you read it. And if it's negative before, if it's positive, we cannot give that patient that medication. This is the key. So don't forget about this medication. When it comes to TB, yeah, that's the key aspect. You should avoid this medication and don't use it at all. Because if the PPD is positive, we cannot use it. So that's the common way of giving you some content related to um, rheumatoid arthritis. Like I said, is not osteoarthritis. You cannot um, treat it based on the condition that you have. You have to know how to take care of it, and then help with the problem. The last thing I want to say is, look, if the patient comes in 6 months later, okay, and then all of a sudden, she has like sudden flare up. She came in with a severe flare up of joint. All the joints are swollen. They have swelling. They stiff, and they decrease range of motion. What are your treatment? What do you do? Acute flare, right? Remember, this is an acute flare up. So acute flare up, what are you going to do? You have to know how to take care of this. Acute problem need to be taken care of with acute medication. Don't forget. Don't pick something that is going to take a long time to pick. So I'll give you option. Methotrexate. I give you NSAID. I give you steroid, right? I give you what is it? Adalimumab, right? I give you hydroxy, right? These are all medications that can be given to the patient, right? Which is a selected apply. Which of those you think is appropriate for this medication? One, two, three, four, five. Patient came in with acute flare. Which of this should you give it to the patient? Do you give them NSAIDs or steroids, methotrexate, adalimumab, or hydroxychloroquine? What do you think the doctor is going to order? Hydroxychloroquine will take some time, right? Adalimumab will take some time. Methotrexate will take some time. Number one medication they're going to get is NSAID, right? And then followed by steroid. So those are 2 and 3 are your management. And this is Adapting class. Thank you for watching. I hope you learned something about rheumatoid when you see a case and the difference between osteoarthritis. If you need more, you can look down and subscribe and watch our musculoskeletal videos. Good luck in your exams or join our membership on Adapting class. We have two membership. Take care of yourself and good luck.